Epileptic medications. So in this lecture we are going to talk about the anti-epileptic medications and their procedures for prescription. So first we have to talk about the prescription method. So the seizure or the anti-epileptic medication we have to prescribe on the base of epilepsy type or can be the efficacy of the medication. For example, if we have prescribed a medicine for an epileptic patient first time, and we have if we prescribe first choice medicine and the seizure persists and doesn't relieve, so then we have to jump on the second choice of drug. And when the adverse effects of the first choice drug exist, then we have to taper it. But if when the adverse effects doesn't exist of the first choice of the drug, then we have to prescribe and continue it with the second choice drug. But if by the prescription of second choice drug, if the seizure persists, then we have to jump over the third choice, in which we have to prescribe combination therapy of the two or more anti-epileptic drug. But if the third choice, by the prescription of third choice of anti-epileptic medications, the seizure exists or persists, then we have to go on the final step, which is the vagus nerve stimulation. Then this will be the last option with us. So this is the method of prescription of the anti-epileptic medications, which is in a cyclic pattern. Which is in a chain pattern. So now we are going to discuss medication therapy for each type of the seizure and discuss the first, second and third choice drugs for each type of the epilepsy. So we have to draw a table for it, in which we have to write first choice, second choice, third choice, and the last one will be vagal stimulation. So for focal type of seizure, the first choice of medication will be lamotrigine, levetiracetam, the second choice of drug for focal seizure will be carbamazepine, lacosamide, and can be pregabalin. The third choice therapy for focal seizure will be Devalproex, gabapentin, carbamazepine, So, and the last one choice will be vagal stimulation. Now the another type of seizure, which is absence seizure. For absence seizure, the first choice of medication will be Divalproex, and lamotrigine. The second choice of drug will be ethosuximide. The third choice will be levetiracetam, topiramate. Now the another type of seizure, myoclonic seizure. For myoclonic seizure, the first choice therapy will be Divalproex, levetiracetam. The second choice drug will be lamotrigine, topiramate. So this will be the second choice of drug for the myoclonic seizure. The third choice of drug will be benzodiazepine. And can be zonisamide. Now for the status epilepticus. So first we have to know about the status epilepticus. That what is the status epilepticus? The status epilepticus is a condition in which the seizure attack come over a patient again and again after a short time of interval. So then we can call it as that it is a status epilepticus. So for the status epilepticus, the first choice of drug will be benzodiazepine, and can be fosphenytoin. For the status epilepticus, the second choice drug will be the barbiturates, which can be barbitol group. Barbiturates, for example, phenobarbital, etc. So this will be the second choice of medication for the status epilepticus. There is no another choice for this type. It means that we have to take the barbiturate for the second choice for the management of status epilepticus. Next, tonic-clonic type of seizure, drug therapy for the tonic-clonic type of seizure. The first choice of medication will be lamotrigine, and can be levetiracetam. The second choice will be Divalproex and zonisamide. And the last one choice will be vagal stimulation. So for some type of seizure, the vagal stimulation we can prescribe, but not in all type of seizure. So we have discussed about some special types of seizure in earlier lecture. So the medication therapy for the type of seizure epilepsy will be, this can also be prescribed as first and second and third choices in a chain pattern. So, and that we have to write it first, second, third. So now the types that can be benign Rolandic. So for the benign Rolandic type of seizure, the first choice can be gabapentin and lamotrigine. The second choice will be carbamazepine and levetiracetam. The third choice of medication therapy for the benign Rolandic is Deval-Proex. So the another special type is infantile spasm. So the first line therapy for the infantile spasm is corticotropin and vigabatrin. The second line is benzodiazepine and Deval-Proex. The third line for infantile spasm is Deval-Proex and can be oxcarbazepine. So this is the choice of medication for the infantile spasm. The another one is the Lennox-Gastaut syndrome, in which we have discussed that this type of seizure is the combination of any other types of seizure. So the first line medication for Lennox-Gastaut is Deval-Proex and lamotrigine. The second line will be levetiracetam and vigabatrin. The third choice will be benzodiazepine. And the last option will be vagal stimulation. So these are the medications therapy for the different types of epilepsy and their prescription, which is a chain pattern prescription if the previous one therapy doesn't work. So then we have to jump on the next, and then on the next, and can be prescribed in combination. And in some type we have to use the final option, which is the vagal stimulation. All these drugs has its own mechanism of actions and has own adverse effects. So on detail we have to we doesn't have any time. We doesn't have as much time to discuss each one of them on detail, its mechanism of action and its adverse effect. So it is the topic of pharmacology. So we have discussed each type of epilepsy and its prescription method and the drugs which are helpful in each type. So that's enough according to the epilepsy medication treatment. Thanks a lot.